Hello, my name is Hassan Abbas, and I'm a third year medical student at Midwestern University. Today, I'm going to be going over an interesting case where we had a patient who came in with a very high white count, but the immediate cause wasn't apparent. A 64-year-old female with a past medical history for a recent diagnosis of left upper lung squamous cell carcinoma of the lung appeared to the emergency room with weakness in her left leg and status post a fall. Associated symptoms included extreme fatigue. Patient hasn't started chemotherapy at the time. On the exam, she appeared very frail and lethargic. The lower extremity group strength was 4 out of 5 with intact sensation. The lab values were significant for a white blood count of 145.3 and a calcium level of 14.2. As you can see in the poster, the CT chest revealed a multifocal pleural thickening as well as a lung mass approximating 79 millimeters by 64 millimeters. The patient was admitted and treated for her hypocalcemia with IV zoledronic acid and subcutaneous calcitonin. Her calcium levels from admission time gradually dropped to 10.6 3 days later, though the patient's white blood count remained elevated. The leukocytosis etiology remained unclear. However, it was most likely that the patient had hyperleukocytosis-Hyperleukocytosis-Paraneoplastic syndrome. The risks of hyperleukocytosis include life-threatening increased blood viscosity as well as tumor lysis syndrome. In the presence of leukocytosis, it's first necessary to rule out leukemia reaction and chronic myeloid leukemia. So this patient did have a high white count, but it wasn't within that range to qualify and quantify as a leukemia reaction. CML, on the other hand, we performed a bone marrow aspiration to rule it out, and we did not see predominance of myeloid cells on the blood smear. In this case, we came up with the conclusion that the patient's hyperleukocytosis was most likely due to paraneoplastic syndrome. A true paraneoplastic syndrome is actually confirmed if a full normalization of blood cell counts rapidly occurs after resecting a tumor. So why is this important? Well, lung cancer actually remains as one of the most common causes of mortality worldwide. And it makes it worse. It's a poor prognosis condition if paraneoplastic leukocytosis is present. I just want to take a moment and say that the patient did not have surgery and we weren't able to confirm if the white blood count went down. Thank you.